Hi everyone, my name is Ngozi Njoku. I'm one of the medical providers at Canon Clinic. Thank you for joining in today. Please don't forget to like and subscribe to our YouTube channel because we're going to be providing with a lot of educational videos which you do not want to miss. Today we're going to be talking about a common chronic condition called hypertension. What is hypertension? Hypertension is when the force of blood flowing through your blood vessels is consistently high. Now typically you go to doctor's office, they check your blood pressure, you see two numbers. A lot of people don't know what are these numbers. You have a top number and a bottom number. The top number is called the systolic and the bottom number is called the diastolic. So if the systolic is greater than 130 or more and the diastolic is greater than 80 or more, for at least 2 to 3 visits to the doctor's office, you're diagnosed with hypertension and the doctor will set up a treatment plan, probably put you on antihypertensive medication, or they can recommend lifestyle modifications. But that's not what we're going to talk about today. I'm going to make a different video where I'm going to talk more about the numbers, more points you should be concerned about your blood pressure. So we're going to talk about the statistic. Why is this a common chronic condition? Well, according to the Centers for Disease Control and Prevention, nearly half of all Americans have hypertension. They don't even know they have it. Why is it called the silent killer? Well, it's called the silent killer because a lot of people don't even have symptoms. They have no idea that they have high blood pressure. Now, what are the risk factors for hypertension? So I'm going to group this into two. We have the non-modifiable risk factors and the modifiable risk factors. Non-modifiable risk factors are factors that you can't even control. For example, genetics. Hypertension is more common amongst Black people. Your age. The more we age, the older you get, the arterial wall stiffens, causing that increase in blood pressure. Your gender. Gender sounds like sometimes more females than males tend to have high blood pressure. Chronic kidney disease, you can't control what family you're born into. And then when we talk about the modifiable risk factors, now these are things that you can control, right? Smoking, for example, excessive alcohol intake, living a sedentary lifestyle, lack of physical activity, diabetes, obesity, being overweight. Those are things you can control. So why should we be concerned if your blood pressure is consistently high? Well, if your blood pressure is consistently high, it puts you at risk for stroke, a myocardial infarction. It can damage your major organs like your kidneys. It can damage your eyes, your heart. So you should be concerned if your blood pressure is consistently high because you're at risk for these things that are just listed. Now, the question is, what changes can you make to be able to manage your blood pressure? Eat healthy, eat less of processed foods. A lot of processed food contains a lot of sodium. For example, your breads, your pizzas, your bacon. Eating out, you don't know how much sodium they put in all this. Why is sodium a huge concern? Well, when you eat foods that are high in sodium tends to retain fluid in the body, and when fluid is retained in the body, it shoots up your blood pressure. So just a fun fact, the American Heart Association recommends that you take less than 2,300 milligrams of salt a day. Guess what? A teaspoon of salt contains 2,300 milligrams of sodium. So for people that already have high blood pressure, it's recommended that you can take half a teaspoon or even less than 1,000 milligrams per day. I think that's doable. So when you go out to get your groceries, pay attention to the nutritional labels. Try to make more home-cooked meals, so that way you avoid the risk of taking in too much sodium. Secondly, exercise. The American Heart Association also recommends 150 minutes a week of exercise. That means 30 minutes, 5 times a day. Walk around your block, do something, move around. That's really going to help you. It makes a huge difference on your blood pressure. Also, manage stress. Stress is another factor that can shoot up your blood pressure. Ways that you can manage stress: listen to music, do things that you love just to help you. Deep breathing exercises would also help you manage your stress. Quit smoking. Smoking is a huge factor when it comes to high blood pressure. And don't forget to take the medications that your doctor prescribed. If you keep taking your medications and you notice that your blood pressure is not even changing in any way, it's still the same, let your medical provider know what's going on with your blood pressure. Make sure you're checking your blood pressure every single day. That's very, very important. Thank you for watching this video. Don't forget to like and subscribe to our YouTube channel. Enjoy the rest of your day. Thank you. Bye.